Hello people, in this video let us look at this PYQ, previous year question on rotator cuff muscle. So basically the question they have asked exactly is describe the components of rotator cuff, functional importance of rotator cuff. Okay. Then based on the story that they have given on top, they have asked one question saying anatomical basis for the maximum pain felt in the mid-range of abduction. Okay, now let us look at the story. But what you have to answer is these three questions only. Remember, what is the story now? A 30-year-old cricketer. So this guy is a cricketer. What happened to him? He has pain in the right shoulder. Somewhere here he has pain. Okay, I'm saying this is his shoulder, is it? Okay, somewhere right shoulder. He has moderate pain. Okay, not much for last 2 weeks. Okay, so who is he? He's a cricketer. But he has pain. Okay. The pain was severe enough to prevent him from bowling. Okay, he cannot bowl. So he went to a sports medicine specialist who observed that the maximum pain was felt in the mid-range of abduction. So what do you think shoulder abduction mid-range is? So let us say this is that fellow and this is his shoulder joint, right? This is his shoulder joint. So he can abduct the shoulder, right? Zoop, he can take it and he can make his shoulder almost like this, right? You can raise your shoulder and put it across your head, right? So somewhere mid-range, somewhere here he has pain. Till here only he can. Mid-range he has pain. Pain he has there. Okay. If you understood what I said, hopefully. So where were we? He visited a sports medicine specialist who observed that maximum pain is felt in the mid-range of abduction. A diagnosis also they have given. The diagnosis is given, so it is very easy for you. What is the diagnosis? Rotator cuff tendinitis. Okay. Rotator cuff tendinitis means tendons inflammation, right? Okay. Now, what are the questions that they have asked you guys for 5 marks? So this is a clinical question in anatomy paper. So remember, so they're asking you the components of rotator cuff, importance of rotator cuff, and anatomical basis for the maximum pain felt in the mid-range of abduction. Ready to see the answers? We want marks, right? So quick marks, where will we get? They have asked which are the rotator cuff muscles. So rotator cuff muscles are supraspinatus, that is here above your spine of scapula, infraspinatus, subscapularis, which is in anterior they have shown here, and teres minor. Remember, it is teres minor. Major has been removed from this diagram, the labeling. Okay, this is the teres major, this one here, but we have removed its labeling. Why? Because we are focused on what? Rotator cuff. Who and all are there in rotator cuff family? Supraspinatus, infraspinatus, subscapularis, teres minor. Okay, very good. Now, what is special about these muscles? See how they are attached. They all are going from scapula to humerus. From where are they going? Scapula to humerus. Okay. We are focused only on those 4 muscles, guys. So they all are originating on scapula and going to humerus. Even teres major is doing the same, but he is not included in the family. He's major. He's gone out of the family. Okay. So which are the 4 muscles and from where to where? Scapula to humerus. These are the rotator cuff muscles. Okay. What are the nerve supply for these? This is the second part of the question. What is the functional importance of this, right? Look at the question here. What are they saying? First question, describe the components of rotator cuff. We have done it. 2 marks. You got it. Functional importance. Functional importance. Let's look at that now. Okay, so what will these help in? Rotation of arm. See here. Rotation of arm. What will it help in? Rotation of arm. That's why it is called as rotatory cuff muscles, right? Supraspinatus has one more job. What it is? Abductor of shoulder joint. Okay. What is it? Abductor of shoulder joint. Very important for you to focus here on this point. Supraspinatus is the abductor of shoulder joint from some degree to some degree, along with deltoid muscle. Along with whom? Along with deltoid muscle. Supraspinatus and deltoid. Okay. Are involved in initiation of abduction and continuation of abduction. Okay. What else you need to know? That's all. Other 3 muscles you will say rotation, rotation, rotation. Okay. Functional importance, we can consider it as done. Okay. Now, what about the, and one more importance is there of that, it will stabilize that humerus and the shoulder joint and all. Okay, that also you write. Coming to the third question, this is where all the story is coming. Anatomical basis for the maximum pain felt in the mid-range of abduction. Now you have to write for 2 marks a lot of things. Okay, first thing, what is abduction of shoulder? See here, this is right shoulder joint. You're looking at the person, he's facing you at the patient, right? And he cannot, this is abduction, that is the shoulder joint going away. Okay, lift your shoulder arm. Okay, that is abduction of your shoulder. Now, you can make your abduct your shoulder to a lot of level, right? But for him, this person, cricketer, this guy who is now has injured himself, he can, in this mid-range, somewhere in the mid-range, he's feeling pain, right? He's feeling pain more where? In the mid-range. So somebody who is working in the mid-range is the problem, right? And who is that? Yes, you already guessed, because it is rotator cuff tendinitis. So who is the muscle affected? Supraspinatus. You got it or not? So shoulder abduction initially is by supraspinatus and mid-deltoid muscle, right? And till when? Till 90° around that, it is supraspinatus and mid-deltoid. Who is affected here? Who is the part of rotatory cuff? Supraspinatus. After this 90°, who takes over? Serratus anterior. Even more, if you want to do, from then you can use trapezius. Okay, serratus anterior and trapezius, same angle only they have given. Okay. Okay, beyond 90°, serratus anterior and trapezius. Very good. Very good. So, who should you focus on now? See that supraspinatus tendinitis has happened now. So this is some diagram which shows the movements of shoulder joint. Anyways, we have told you which is the muscle that we are focusing on, the supraspinatus and deltoid. Okay. Apart from that, lot of others will help. Who are they? Serratus anterior and trapezius. But we are not focused here on those muscles. We are blaming now supraspinatus affected. Where is supraspinatus? Here. Posterior view, you can see on the spine of the scapula, supraspinatus muscle. From where is it going? From the scapula to humerus only it is attaching, and it will also stabilize the humerus, that humerus head, and it will stabilize your shoulder joint. It will also allow movement of the shoulder joint, especially the abduction along with deltoid muscle. Very good. Now, if somebody asks you why mid-range only it is occurring the pain, you will say because supraspinatus will help from 0 to 90° along with mid-deltoid. That is why it is going to pain. Beyond that, other muscles will take care. So hence, the person is not affected when he raises beyond that. You understood, guys, what you have to write in the exam, right? Just in case they had not given you the diagnosis, then what would you have done? See, then you will have to write some more assumptions and all that. Then you will say, see, the pain could have been due to tendinitis, or it could be bursitis, or it could be some impingement, okay, where some, you can read this, okay. Basically, some impingement also can happen. It could be bursitis also. That is all differential you can write. But they never said, if it was bursitis, they would have said if you press some place that pain is there because you press on the bursa or something. Okay, but that is not what they have told here. Now, what is happening here? It is in young athletes, etc. They do repetitive effort, work, and hence they have this minor injury. Okay. How will you treat? Just put one word for treatment and close it. You will get full 5 marks. Rest, physical therapy, some painkillers. Okay. So did you explain the components of rotator cuff, functional importance of rotator cuff, anatomical basis for the maximum pain felt at the mid-range of abduction? Okay, this is a clinical question asked in anatomy, theory, final exam, MBBS, first year. Okay.